Welcome to the Focus Physical Therapy channel. If you are not doing these 5 fundamentals for low back pain, you are missing out on a great opportunity to help yourself. Find out on today's episode all about the low back.
I'ma wake up, do bench. Join number 7, Z's boredom. Working on I need more though.
I'm Burke Selbst. I'm a physical therapist as well as a low back pain sufferer. And these 5 fundamentals have helped me and have helped many of my patients over the years. And I'm happy to share them with you. First time to the Focus Physical Therapy channel, welcome. Thanks so much for coming. Be sure and hit that subscribe button and tap the little bell notification so that you are informed every time we post a new video. If you have a physical problem or you're interested in movement, in training, in performance, in sports, in life vitality, you've come to the right place. I hope you'll consider subscribing and joining me on this adventure. Let's dive right into it and bust some myths about low back pain. Number 1, you are in serious danger and something is very wrong. Now, this is a myth because the research does not show severe structural injury with what we think of as routine low back pain. Many of us will experience low back pain over the course of our lives, and the vast majority of the time, it is not structurally serious. It is not dangerous as much as it hurts. And believe me, I know how much low back pain can hurt. It is not something to be afraid of. It is not dangerous. Myth number 2. I get asked this a lot in the clinic. You do not need imaging for a routine case of low back pain, even if it's very severe. This is very important. People understandably want answers to why their back hurts, but the research does not show that imaging helps us identify people who have symptoms from those who don't, severe injuries from less severe injuries, and who's going to respond to specific treatments. It does not help with any of that. You can avoid the cost, you can avoid the anxiety and the fear by skipping the imaging. The final myth is that there is a magic pill, a magic treatment, a magic exercise, or a magic provider for you to help with your low back pain. Now, this is a myth because there are so many things out there that can be helpful because they fall into one of these 5 fundamental categories. So let's jump into those right now. Here they are, 5 fundamentals for low back pain. Number 1, movement matters most. This is very important. Your body needs 2 important ingredients to heal. It needs blood flow and it needs time. So time is not something any of us can control, but blood flow you certainly can. And you're going to do that by moving. Move in small doses frequently throughout the day. I'm going to show you my favorite exercises in a separate video, so be sure and come back if you would like to see the exact movements that I will give my patients through the different stages of recovery from a low back injury. Fundamental number 2, recovering from low back pain is a journey. Starts at point A, gets to point C, D, E, F, wherever that final point is. That means that you are doing great, and the way that you're going to get there is by walking. So this is our fundamental number 2. Walk your way towards progress. Walk frequently throughout the day when you have low back pain. Doesn't have to be for long, 5 minutes, 10 minutes, 20 minutes, but do that multiple times in a day. This is one of the simplest and most effective forms of exercise, and it's yours for the taking. Fundamental number 3, pay attention to your posture. Posture is how you sit, how you hold yourself, how you move. All of those things combine to equal your posture, and it makes a difference. Often when we have low back pain, we are tight, we hold ourselves tight. Our muscles may even be in spasm. This is understandable. It's anatomical. It's part of the process of the inflammation that we're trying to get you past, but that can lead to you either holding yourself in really awkward, stressful ways, or collapsing your body structurally so that you end up putting stress where we don't want it. If I hold my finger like this, no problem. This is my range of motion. It's fine. If I take this finger and I stretch my finger like this, now all of a sudden I feel a little bit of discomfort right here. And if I go away and I continue to do this and I come back in an hour, this is going to hurt like heck. So this is posture. Posture is when you hold your body a certain way that is not helping and it's maybe causing a little more pain and discomfort. So watch your posture. Use good support. Keep yourself in neutral posture and avoid slouching or the alternative, hyper contraction of your back muscles, because both of those extremes are not going to help. Fundamental number 4. Manage your stress and your mind. This is part of the fundamentals because so much of recovering from any injury is a mental game. There is a certain amount of power that your beliefs have over your recovery. The power to do good and the power to do not so good or to hold you back. Your mind matters, what you think about your low back. When an earthquake happens, there's the initial earthquake and then there are the shock waves afterwards, and those shock waves can do tremendous damage. Back pain and what our minds do and our stress levels do afterwards are like those shock waves. They can create considerable pain, discomfort, muscle dysfunction because we're creating extra protective contractions where we don't need them. If you could start with one simple idea to just repeat this idea, is that you are going to recover. You're going to get beyond this. This is a temporary state, a temporary situation. You will survive. You will thrive. Tell yourself this over and over. Every time you start to feel doubt, every time you start to feel fear, anxiety, depression, anger, sadness, any of those emotions, tell yourself, I am going to get through this. I will survive this. I will overcome. I will thrive. This, incidentally, is not just psychological positive thinking. It's proven in the research that of the folks who have low back pain, regardless of the treatment they choose, whether they choose to do something invasive like a back surgery, or whether they choose to manage it with physical therapy or other modalities, they ultimately, after a year's time, end up more or less in the same place. So this is well supported in the literature that you are indeed going to get through this. So make that a mantra. Talk to yourself out of stress, worry, anxiety. The last fundamental, mobilize your superpowers. Now, you may or may not know that you have superpowers, super healing powers. I'm going to highlight 3 important behaviors that you can work on to improve your body's superpower healing ability. Number 1, if you're a smoker, you need to quit. There is no easy way to say this. Smoking increases low back problems, among many other things. It causes more pain. For many, many reasons, you've got to stop smoking. Number 2, pay attention to your diet. Avoid sugars and things that are inflammatory, empty calories. Eat well. Your body needs nutrition in order to rebuild itself. So give yourself what your body needs. And lastly, make sure you're getting enough rest. Rest is such a key component of healing and recovery. And many of us in this fast-paced modern world are sorely lacking in either total quantity of rest or the quality of it. So if you could identify in your sleeping patterns 1 or 2 simple things that you could do that would make a positive difference in how you sleep, make them. Your back will thank you. So here are just a couple of my favorites. 1 is the position of comfort, and 2 is a little mini move. It comes from the Feldenkrais world, and I have found it to be so useful for helping in those early stages of low back pain.
Yesterday, there was sun and there was rain, beauty in the mundane. And as the light startled our eyes, we let go of disguise.
Thanks so much for joining me today. I hope this has been helpful, and we'll see you again soon.